Ready? Hello, everyone. Hello. We're gonna start in a second. We just got live. If possible, it'd be amazing if you guys could share this. Share this with as many people as possible. I'm gonna share it right now into our different groups. I'm gonna share it. We got some great information that'll be coming to you tonight. Some amazing information. So just bear with us just for a few seconds, and we're gonna start. So first of all, hope you guys have an amazing day. Hope you have an amazing day. And you know, the profitroom.com, even though we're a stock market trading and education company, we're also a company that's family oriented. We like to bring information to people that we can benefit our whole community. And recently, we all are affected by what's actually going on in the world. And we want to make sure that we are educated. We always want to make sure that we're educated. We always want to make sure that we are in a situation where we can affect our people, in a situation where we can positively build each other, no matter what we go through, right? Because we are a community. No matter what, at the end of the day, we are a community, and we want to make sure that we're able to help people, especially in different times that we're dealing with, these crazy times right now. So we welcome everyone. We have Dr. Kelly's here, and Dr. Kelly is going to be giving us some insight on what we're dealing with. So Dr. Kelly, can you just tell a little bit about yourself, who you are, what you do, things of that nature?
Sure. Thank you well, first, thank you for having me to speak to your group. So I am Dr. Kelly. I'm a board certified endocrinologist. So I treat patients who have diabetes and other hormonal conditions. I'm also a bounce back coach. So I also help high performing women overcome past hurt to have a happy, healthy relationship. So yeah, we're just here to talk about coronavirus and to answer any questions that you guys have.
All right. So we're recently, like I'm in New Jersey. Latoya is also in Boston, and soon as this thing hit, I know amongst our community there was this mindset thing of it's not affecting us at this point. Is really not affecting us at this point, and then all of a sudden it just hit us very hard. It hit us very hard amongst our community, you know, African American, Latino community as well. So my question I want to ask you in the beginning, um, does it matter, right? The age of certain individuals, or the health conditions amongst even our people, like how it really affects us during this time?
Yes, certainly. So it's been found that the older you are, the higher your chance of having um, pneumonia, higher chance of even dying from coronavirus. So initial data coming out of China showed that the overall death rate was about 2.3%. But if you were over the age of 80, your chance of dying was up to 18%. So the older you are, it appears as if your immune system might not be as strong. So you're more susceptible to infection and even dying from infection. And like you said, the older you are, you're more likely to have those other comorbidities, things like diabetes, hypertension, chronic kidney disease, lung disease. And most of the people who've died in the United States have had some kind of underlying illness.
Right. All right. And that's what I was wondering, because I remember watching before even like scheduling this with you. I realized like even some of the people I see doing work out on the streets and stuff like that, and that's what CNN even brought into place. Usually are people. We have some of the jobs that are laborious. Either it's like fast food sometimes, We're cleaning up. Like I have a handyman that I have helping me out doing work sometimes, but I can't even pick him up to do work. And I always say, hey, here's a mask or here's something. Hey, I'm not worrying about it. I'm going over such and such to go do his yard or clean his yard. So with that type of mindset, how fast can that actually spread amongst our community?
It's really disheartening when you look at numbers coming out of Louisiana, numbers coming out of Chicago. I actually wrote it down because I really want to hit home this point. So
Uh,
in Chicago, I think the Blacks make up about 30% of the population. However, about 70% of those who died from coronavirus are Black.
yeah,
So why is that? I think there's so many reasons for why this is happening. One, we are more likely to have the diabetes, the hypertension, the obesity, and the asthma. Also, there's lack of access to testing and just lack of education. Initially, we thought that, Black people, people of color were immune to coronavirus, but that's not true. So a lot of us weren't taking it seriously initially.
mhm.
The social distancing, a lot of us live in overcrowded communities where how can you social distance when you live in an apartment with like 6 or 7 people, So it's a lot harder for us. And I hope by now we're taking it seriously because I think the death rate was over 10,000 people, I think, this week. So all of us might know someone who has been
Yeah.
affected. Yeah.
And the thing is, like, I have about four relatives that affected. So I'm here in New Jersey. So chronic, I have a cousin of mine, um, older cousin. And like I was mentioning to you before, he just went to dialysis about a week ago. Now they got him on hospice because he's affected by it. You know what I mean? And I read the same thing like you were saying in Chicago. That's just unbelievable. That many people in that area. So then even like what you said, Fauci and Trump mentioned it. What was it, Tuesday?
Yesterday, yeah.
This saying it's affecting us even more. I know groups of families, like you mentioned, we all come from different backgrounds that live together, 7 to 8 people. So that thought process, if you're living amongst somebody, like I know 2 or 3 people, what is some of the best things you can possibly do, even if somebody in your household does have it? And you are probably in maybe a 2 bedroom apartment, like most of us may have lived in our community with 4 or 5 people. Is there any type of way like you can adjust your life?
It's going to be more difficult, obviously, but if you can use a different bathroom or a different bedroom from the infected person, that would be helpful. Not sharing utensils. If you're caring for someone who's ill with COVID-19, you should be wearing a mask, and the sick person should also be wearing a mask. And we can talk about if you should wear a mask later on, but if you're caring for someone, both of you guys should be wearing a mask. You should use gloves to, like, if you have to wash bedding or wash clothing, use gloves. Anything that has soil, like soil with body fluids, wash them separately, trash them, use gloves whenever you handle anything that's soiled with bodily fluids. That's the best you can do. Continue to, wash your hands for 20 seconds. If you can do the 6 feet apart thing, do that as well. But I could imagine how difficult it would be if there's not another bathroom that you can use or another bedroom that you can go into.
Because the way a majority of people are contracting it is with touching items or just the more majority of breathing, the air quality, right?
So COVID-19 is said to be spread by droplets, meaning that if I cough or I sneeze, droplets come out and it could land in somebody else's mouth or nose. Or the virus has also been found to live for hours on like surfaces like countertops, pressing the elevator button, turning the light switch on, opening a door. It lasts on metal. So if someone coughs or sneezes and a droplet lands on a door handle, and I open it and then touch my face, I can also get it through that way too. That's why we're saying avoid touching your face.
Okay. So what is your thought process on, and I'm gonna tell you a story about my neighbor. This is speculation, it's not facts. With the 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 fast food restaurants still being open, the delivery of, I mean, not regular goods, like cooked goods, like, you know, that are being the pizza and all the other stuff that's maybe hand tossed. What are your thought process on that?
So as of now, there's no evidence that COVID-19 is spread by food.
Mhm.
If you like, whenever I do takeout now, even if it's hot, I still put it in the microwave just to heat it up
Okay.
some more. So if there's any virus that's still left on the container or anything, I'm just killing it. But right now, COVID-19 is not spread by food.
Okay.
Obviously, it's also actually spread by what we call fecal oral route, meaning that if someone did a number two and did not wash their hands properly and then handled your food or your stuff, the virus might also be on the surface. But for the most part, if you make sure that the food is well cooked, microwave it again when you get takeout, you should be fine.
Okay. Got you. Because with my, this is my ignorance, right? Because I was talking to my neighbor. One of my other neighbors, unfortunately, she passed,
Mhm.
and he was like, they order food all the time because they were self quarantined. She caught it from her daughter, who's a college student, unfortunately. And that's the sad part about it. And we'll talk about that too. And her daughter has it, and being a mother and a caregiver, taking care of her daughter, she catches it and reacts worse than she has. Now, she seemed healthy to me. And she all of a sudden she passes from it, and I'm like, I thought they were self quarantining, I thought they were, staying to themselves and things of that nature. Then you get the call that she passed. So now, not the sickness side of it, so let's think of us as a black community or minority community, um is you got two daughters, she has a husband, and they
Mhm.
lost their mother. Now she got to live with the psychological fact that her mother caught something from her, right? Now her life has changed. So
Forever.
that's something we could talk about too, the mental aspect of it. But then the fact that she reacted so well. So I'm thinking like, oh man, like maybe it came from the food. And I'm glad you cleared that up for me. But like because I used to see them ordering all the time. And I thought like maybe they handed them money, maybe something happened like that, because I'm paranoid because I'm in the hot zone. So I'm glad you brought up that little my thought process where it doesn't travel like that. But going back on her situation, she seemed healthy. And to my awareness, young woman, only 46 years old, she had no health conditions. I mean, is there a way to explain something like that, period?
So what they found is that 5% of patients who have coronavirus or die from coronavirus don't have any underlying health condition. They don't.
Okay. Okay, got you.
But your risk is higher, much higher, if you do have diabetes or hypertension. And someone could look to our eyes perfectly healthy, but they could still have hypertension that
Correct.
you might not know of, even diabetes that you might not know of. Um, but
And
yeah,
and that and that's what they said when I was looking at the article and I'm reading it here on CNN. Even the Surgeon General, um, he has high blood pressure. We have high blood pressure. What are other chronic things that we have?
doesn't he? And he looks pretty fit, right?
Yeah, like, and it's weird because I had a buddy like that. We was going out for steaks one time. This was years ago. Slim and fit and everything like that. He went to the doctor. Boom, he has high blood pressure. He said, "Hey, it's probably genetic or something like that." We got lung disease, heart disease, and that
Yeah. So
asthma. Like,
a lot of
yeah, I had asthma growing up. Unfortunately, as they say, I grew out of it, but I understand that part. And now, when we shift over to that to our community and dealing with this, what makes it even worse is, I know me and you talked about this before. Your baby based in Atlanta about the testing. Can you shed some light what you feel about like testing and what's actually going on with that?
So, unfortunately, maybe 2 to 3 weeks into this, we realized that there are some people who are asymptomatic carriers, meaning that I could be infected with coronavirus, and one, I could never have symptoms, but I could still spread it to somebody else. Also, someone could be infected with coronavirus and the symptoms only start maybe 4 to 5 days later. And we know that when someone is first infected, they're the most contagious then. So that means I'm not coughing yet, I'm not sneezing yet, I'm just walking around, talking, laughing, breathing, and I could potentially be spreading coronavirus to somebody else. In an ideal world, we could all be tested to see, which of us were asymptomatic carriers. Those people would have to, self quarantine. But even patients who have symptoms, initially we thought the symptoms were fever, cough, shortness of breath. Now we know that some people present with diarrhea, headaches, fatigue, just feeling run down. So a lot of people don't meet the strict criteria that they have for testing, and they're not tested, and then they don't take the necessary precautions. Also, there's some patients also have what we call a false negative test, meaning that
Okay.
it's too early in the disease process for your test to come back positive, but you have all of the symptoms. And right now, I'm telling those patients, if you have those symptoms, even if the test is negative, still behave as if you have COVID-19. I
Correct.
think if we had more testing, that we would be able to slow the spread down. Because right now I'm feeling fine. I'm still having to go to work. If I were
Yeah.
tested and I was found to be an asymptomatic carrier, automatically I would have to stay home and not expose anybody that I'm coming into contact with at work. You know what I mean? So
No,
need more testing for sure.
and the thing is like it's the paranoia. Like your parent like listen, I was working out the other day, like doing some push-ups and working out and things like that. And I'm being straight up. And like 2 days later, because I'm used to going to the gym, I'm sitting here at my office working, and I forgot I worked out my chest, and I'm breathing in and out. I'm like, oh Lord, listen, Dr. Kelly, I said my prayers, and I knew I had it. Listen, I knew I wasn't waking up because I was just paranoid, and like, all right, let me just, whatever. But I had no fever, no cough, or anything like that. It's just that paranoia that you feel like that. So, and I know I want to talk about the financial aspect just a little bit as well. And majority of us in our community lack the insurance. So how is that affecting us as well? Because they brought that up. I mean, because the type of jobs we may have and the things we may have, like that's a big deal too, right? Dealing with all of this, because I know the big farmers and the rest, they want to get paid. How is that affecting us in our community as well?
Yeah, certainly. A lot of people who don't have insurance or are underinsured might not want to go to the emergency room. A lot of us are staying at home and ignoring symptoms and dying at home. Um, so I would encourage anyone who's having worsening symptoms to get to the nearest emergency, well, call first and then go to the nearest emergency room if they think that you should come in. But emergency rooms are not allowed to turn people away.
That's what they say.
You're not allowed, I think it's
That's what
against
they
the
say.
law for them to do that.
Okay. All right. All right.
I think some insurance companies were giving you like a bill for the COVID-19 test. I have heard people talk
Hmm.
about that. But like I said, most emergency rooms are not going to turn you away. If you need to be admitted, you're going to be admitted. But I understand that
Now,
it is a concern, definitely a concern.
but now let's talk about that. I know you're not going to go against anything medical with that aspect. That there's some people that are being advised if you don't have like you don't want to go to the hospital because you feel. I mean, especially up here, because if you go to the hospital, you already know like C. diff or something like that. It's like all right, you go to the hospital, you're going to get COVID. You know what I mean? Like that's been the mindset amongst the streets. Like I want to go home and just take care of myself. I mean, I know you're not going to go against that, but let's just talk about that a little bit? Like, there's a stronger chance if you do get admitted, or am I just paranoid with that?
A stronger chance of what?
You catching the COVID in a hot zone being admitted. Because when you look on TV and you see them beds in the hallway and stuff like that, and you're at high risk, I mean, what's your thought process on that?
So I heard an emergency room doctor say recently that she's not seeing cases of like strokes or heart attack or the usual things that she would see in their emergency room, which means
Hmm.
that people are still having non-COVID related illnesses. People are still having strokes. People are still having heart attacks and other types of pneumonia and urinary tract infections. People are still having babies. Like life is still going on outside of
Exactly.
COVID-19. So people are staying at home and dealing with these things that they would have normally gone to the emergency room. And I think they're probably dying at home at a much higher rate. So I would
Correct.
suggest like you still need to go to the emergency room.
Hmm.
I Some emergency rooms are putting masks on every person that comes in. Not the mask that protects the wearer, but the mask that maybe if you are ill, you're not spreading it to other people. But I would not say stay home. There was a case recently here in Atlanta, near to where I work, where I think she was 40-something-year-old healthcare worker, lived alone with her small child, young child, and her family couldn't reach her. They sent the police in for a welfare check, and she was dead. And she had
Wow.
died at least, they say a minute, but probably 12 to 24 hours before they found her. So I assume she was trying to deal with whatever she was having at home, and it didn't work out for her. And I've heard stories of people like feeling better and thinking they're getting over the hump and then ended up dying. So I would suggest to you, if you have COVID-19 and your symptoms aren't getting any better, if your shortness of breath is getting worse, that you really need to call urgent care or call your primary care or call the emergency room.
Okay. So, all right. I know there was a video going around. Is the major thing, are you really like drowning in a sense? Because they keep talking about your lungs being filled with fluid. What is actually causing the death? Cardiac arrest, drowning? Like when you hear about that, like,
Mhm.
I really want you to be blunt with it. Like, because it, like, I understand my father, unfortunately, he died of pancreatic cancer. I saw him deteriorate. So I know that, right? But when you see something like this, like what are they actually dying from? Like that death.
So, so the so the virus causes an immune response. So whenever virus or bacteria comes into our body, our immune system tries to fight it. So we have white blood cells that release different things that try to fight infection, inflammatory markers. And what I've been reading is that in some of these patients, the immune response is kind of in overdrive, and the inflammation causes scarring of the lungs. It causes bilateral pneumonia, so both lungs are actually involved, and it's hard for them to get enough oxygen into their blood. So a lot of them
Wow.
die from respiratory failure, so they end up on a ventilator, and a lot of people are reporting that it's hard to get patients off of ventilators once they're on it. That's
Because
why
their lungs are weak, right?
lungs are weak, deconditioned, poor oxygenation. I think we're learning so many new things about this virus and how it presents. I've seen lots of cases of people with renal failure having to go on dialysis as a result of COVID-19. It seems to might also affect the muscles of the heart. So some people might be dying from heart failure or even a fatal arrhythmia or fatal like irregular heart rhythm. So as we see how it presents, we're figuring out how it's treated. There's still no real specific treatment for COVID-19. We're just treating symptoms. So for someone who has difficulty with getting air into their lungs without oxygenation, I mentioned earlier, we're giving them high flow oxygen. Some of them are being placed on ventilators. Obviously, if you're at home, if you're not that ill and you're at home, people say, take Tylenol, hydrate, rest up, but there's no specific treatment. I know the president talks about a drug called hydroxychloroquine quite a bit. Um,
Hmm.
that combined with an antibiotic called azithromycin, but that combination is given in a hospital to patients who aren't doing so well. I've seen some reports that it's been helpful. I've seen other reports that it's not. And that should be done under the guidance of a physician, because those two medicines combined can affect how your heart functions. So people have been going out there and stockpiling on hydroxychloroquine and azithromycin, thinking that it can protect them from COVID-19. It's not designed to do that. And you might be harming yourself if your doctor isn't monitoring the drug side effects.
Okay. Wow. So one thing, I don't want to shift too much gears. Can you explain what like a peak is? Like I'm in New Jersey, I'm New York, and they have different states. When they say, okay, these next 2 weeks are peaks, and you have areas like you are in Atlanta, and a lot of our viewers are all over. When they say something is about to peak, what does that mean?
So I'm thinking we've all seen the graphs where, it looks like a kind of like a bell curve, kind of where it goes up and then it starts to come back down. So the peak is where you have the highest number. It depends if you're looking at the peak of deaths or infections. The peak of infections is when you have the highest number of infections. And then after that, you can see it coming down.
Okay.
So what they've been saying is that the cases in New York should peak about, they were saying this week or next week. I heard that in Georgia, it was, in about 2 weeks. So different states seem to be, we speculate will have different peaks. And we were discussing this before we came on, like, when do you start to travel again? Because if New York has hit their peak and on the way back down at the same time that Georgia is coming up, are people in Georgia going to be going to New York and, getting reinfected? There's still some thought that you might get COVID-19, get better, and then be reinfected again. There's also some thought maybe, even if we get over this right now, is it going to come back again in the winter time? So lots of things to consider before we go back to life as normal.
And that's why I wanted to bring you on and speak with other doctors as well, because it seems like even amongst our community, we think like this is going to go away. This is going to change our life. Like I focus a lot on finance, and I see it every single day.
Mm-hmm.
And what happens is almost like we're seeing a band-aid or something be put on, like reality. Like even when I was watching CNN and reading an article, they saying that like unemployment rate so far is like around maybe 4% or something that nature. But then they say in the African American community, this economist from Rutgers say is more like 20%
Mm-hmm.
for us and up to like 18% for Hispanics. Because we're, no matter what, we're going to get affected even more and
Yeah.
even more. If you're not working, we're all into living most likely in different urban enterprise zones is mostly full of us. And like you said, spread, death, disease, spread right at the same time. It's a trickling effect. It's actually a trickling effect. And the reason why I know they say like that social distancing is so important. I have a buddy that works for, he's a VP of a company, real big company. And it's not gloom and doom, but they're realistic. He
Mm-hmm.
was talking about something about they have like an 18-month type of realistic way of getting their people back to work. Like maybe 2 months on with a few people, then taking them out 2 months to see how they affect, then 2 months again.
Mm-hmm.
And like, and I said 18 months. So he said, yeah, bro. He said, and they're doing the math. Like it seems like we forget about the math. Like, unfortunately, if there's no cure, and like you mentioned, that was a great point. I'm afraid to get on a plane. Like I'm afraid to go out to travel somewhere. So if you're going to open up those gates for people to go, right? What's the chances they're going to let us go? And we are the first people to jump on that opportunity because it's $29 to go
Of
to
course.
Miami. You know what I mean? So
Worth
that
it.
that that it's not worth it. It's not worth it when we look at something like that. So one another question just to bring up some things with that. Is this going to bring a need, or how do you feel with going in the future in the medical field? I know there was already a need for like nurses and doctors like yourself. Is this going to change the whole educational aspect of them? Like, is there going to be like a requirement for nurses at companies? I know big companies already have doctors on staff. What's your thoughts about that?
I think it's already changed how we practice medicine. So, I mainly work in an outpatient setting. I have a clinic,
Hmm.
right on the grounds of a hospital. And since this has happened, we have been transitioned to telemedicine, meaning we only see patients like how you and I are talking right now.
Okay.
And my health system got that done in 10 days. And I'm sure they're talking about it for years, but they got it done in 10 days. It's going to change how we are practicing medicine. It's
Okay.
also going to change how we treat our doctors, because I'm sure you would have heard in the news that a lot of physicians are getting sick and actually dying from COVID-19 because they don't
Yeah.
have the adequate personal protective equipment. So a lot of rallying in doctor circles to try to get us and nurses and all healthcare workers the adequate protection that we need to treat our patients. And as Dr. Fauci said like yesterday, this is really highlighting the healthcare disparities in our Black community. So I'm hoping, like he said, when this is all over and all said and done, that we will start to address some of those issues. And your
Correct.
friend's company had that 18-month thing. Initially I was thinking maybe this be over in like, you know, 4 to 6 weeks. But I don't even know, because like you said, how do we determine who goes back out to work? How do we determine when we start having restaurants open again, and different businesses open again?
Hmm. I know. That's one of those things you don't know. One
Right.
question somebody asked before: is there a chance with reinfection?
I
Can you
think there
catch it?
I think
Okay.
there is. I think there is. I think, like, so how, with the flu virus, how the flu has, flu season happens every year, usually in the colder months. And sometimes you can have different strains of the flu virus. That's why the flu vaccine is not 100% protective, because new strains develop all the time. So I think that right now there might be different strains of coronavirus. Like there were some doctors were thinking maybe the strain in Italy was a lot more powerful than the strain here, because they had, their death rate was super high. They had an older population, yes, but perhaps even here, like why California did so much better than New York. So I think maybe if there are other mutations and other strains that you could potentially be infected with it again.
Mhm.
Um, so I know they were talking about, to see if, so some people might have had the infection but did not show symptoms. But you can actually look into their blood for something called antibodies to see if they were exposed. I know the government was talking about maybe checking antibodies to see if someone was exposed and be able to go back out to work. Um, that's a good way to see if they have some type of immunity. But like I said, with different strains of the virus, it's possible to get reinfected.
Okay. Because that was another thing my buddy was telling me with that 2 months off thing. Because he said in some of their locations out the country, they let a small group of people back to work. Then, like a week later, two or three of them got sick again.
Yeah.
And it was just like, here we go. Like, let me bring them back home and things like that. And it's weird because there's so many conspiracies and thought processes. Another friend of mine mentioned that their uncle were like on a cruise in December and came home and was sick for like 2 weeks, like in ICU, and
Wow.
got better. So, you know, it just seems like it's progressing, and it's so confusing at this point. Like some people you hear, oh, I had it already. I know I had it because I got sick in January. Remember that time I was sick? That was it. That
Yeah,
had to
that
be
too.
it. And I'm thinking that could have been it.
It could have.
I'm thinking, so that's what makes this thing like life changing. It just makes it so life changing, and I know our community is always going to be affected by it first. Always going to be affected by it first, and unfortunately, just some of our genetics with the high blood pressure, things of that nature. And the one thing, like I'm glad you're able to come on, because a lot of us here, like we if it doesn't affect us personally, it really doesn't matter. Like I remember during the
Right.
Hurricane Katrina situation, and it bothered me and I was upset, but I wasn't down there, in New Orleans.
Right. Right.
I'm still going to the movies like it's all good, right? Like you said, some people are still going to the beach in other parts of the United States. Like it hasn't affected us yet. But now, since you're on the other side of the foot, you see how it is, right? Like this is like, besides Hurricane Sandy, or I mean 9/11, this is like the worst thing that has happened that I've been through up north, just to see. And that's one of the things amongst our community, like death changed lives all the time. And unless we make it real to us, right? Like you said, hopefully a program will come out with like scholarships and stuff for our community, for us to go to college for free for nursing, or or doctors and things like that. Because I mean, there's going to be no one to replace at the
Right.
rate that's going on. There's going to be no one to replace. So oh man, this was definitely upbuilding for us, and we really appreciate you coming out. So we like to thank Dr. Kelly for coming out here. Uh, we know I share this in a lot of rooms. Dr. Kelly has willingly came here to share her information. Don't forget, she also, I'm gonna put a link here to her site. She has an amazing book, and I'm gonna tell you, Dr. Kelly, there's people
Uh-huh.
on here. So we're going to support everybody. I told you, those who registered that's on, we're going to give them our free ebook. And let me just show everybody your book that we have here. I know I have it somewhere. So just for everybody, so we could always be upbuilding and motivational. Let me see where you're at. Oh, here you go. Don't forget to support her here. Dr. Kelly Wood, this is her book. She helps out a lot of people. And no, we're going to support her as well. So, how many on here right now? We got about a few on here. Because a lot of you guys registered. I told you you have to come on Zoom. You have to come on Zoom to make sure that you come on here. So, Dr. Kelly, here we go right here. Let's just stop screen share. Stop it. Here we go. Stop share. So the profit room, we're going to purchase 10 of your
Oh,
books.
great. Thank you.
You're going to pay 10 of your books. And of course, I'm the nicest guy in the world, so I don't need no relationship advice. But so those that are on here right now, we're going to give out some books here to everybody that's come on. Everybody that's on the Zoom, and plus some others, will be giving out the book. Make sure you go check out her. We're gonna put the her thing inside there as well. So I got everybody. I already screenshot who came up, who showed up, and whoever's also on the Zoom. We will be giving you our free ebook, The Keys to Stock Market Success. That book is $20 value. That tells you about the stock market. It gives you the ABCs and the bringing about how to understand about the different financial markets and things of that nature. So guys, please go like her page. This is
Thank
going
you.
to be
Yes.
on our YouTube channel. Go
Yes.
like her page.
You can find me everywhere on social media at Dr. Kelly Wood, MD. I'll spell it for you, KELLYWOOD, MD. Instagram, Twitter, Facebook. You can find me there.
So what I'm going to do, please follow us, follow all our pages, the Profit Room. So on the main post, what you see this, if you're watching this, we're going to put all Dr. Kelly's information, her page, everything like that. Everybody here, we're going to get you your books out. Don't worry about it. We're going to make sure you get your books. Follow us on Instagram and things of that nature. But that's what I'm saying, guys. You got to sign up for the Zoom. We're going to post on Facebook and everything like that, but sign up on the Zoom. We got more stuff to give out this Saturday. So this Saturday, we plan on doing another one as well. And remember, this is all about community, and we have nothing extra to upsell you here at the Profit Room. You know what we do. You can Google us. You already see our testimonies from our students. Our main motto, is education, application, and also success. But now we're adding the health aspect to it. And these individuals, professionals like Dr. Kelly and many others, when you go on their page, they have a lot of information. They have a lot of information. And since we're in the education business, and you got a lot of my questions earlier about the food I didn't know about and things like that, I don't want to come to conclusions on my own. I'd rather speak to someone who knows what they're talking about and get some information. And that's how we can spread this information amongst our communities. And we can always build up, right? Because you can't have generational wealth without a generation. So remember that, guys. We're chasing life here. We're not always chasing the money. Okay, I see y'all trying to pop in now on the oh, you're trying to pop in now on the Zoom, right? Because we getting books. Okay, I see that. Don't worry about it. We got everybody. So we like to say, everybody have a great night. We look forward to seeing you guys on Saturday as well. And remember, you got to have the health over wealth no matter what at the end of the day. His health over wealth, and we'll definitely be there here to support you and do our part. All right. You guys have an amazing day, and we'll talk to you soon. Take care. Thank you, Dr. Kelly.
Thank you for having me.
No problem.